How your PHS will be sorted out?
Okay, sir.
I'm working on it.
Okay.
Alright, so you can see this. Let's say this is the tendon, right? This is the tendon. I know for instance that when you are trying to pull something, the muscle will contract. You understand? And there will be tension in the tendon. You understand? If the tension is too much, right, the muscle can undergo avulsion. Are you there? The muscle can undergo what? Avulsion. Can pull out from the bone. You understand? So in order for the muscle not to pull out from the bone, right, that is where this deep tendon reflex is important. Because you understand, it helps to inhibit the muscle contraction. You understand? It inhibits muscle contraction from over contracting. You understand? So that the muscle don't pull out from the body, the tendon don't pull out from the bone. That's what we call the deep tendon reflex. You understand? It is inhibitory in nature. So what happens is that you observe that fibers, right, from here, from the muscle, from the tendon, right, from the Golgi tendon organ. Here, this is where we have the Golgi tendon organ. Are you there? Golgi tendon organ. Now, fibers, sensory fibers, and go to the spinal cord, right? Now, what do we call this sensory fiber? What do we call this sensory fiber? We call it type 1. Type 1 or no, type 1B. Right? Type 1B is almost like type 1A fibers, right? They are myelinated and then their conduction velocity is also very high. Are you there? So it goes into the spinal cord, right? And synapses with interneurons, inhibitory interneurons, right? And then the interneuron will now activate the interneuron will now stimulate what? Alpha motor neuron, right? This is alpha motor neuron. It will stimulate alpha motor neuron, which will go and send an impulse. It will send fiber, right, to the muscle. Are you there? And what will it do to this muscle? It will inhibit the muscle. Are you there? It will inhibit what? The muscle. Right? It will inhibit the muscle. It can also send an impulse to it. Another interneuron. It can stimulate another interneuron. Right? Which will also stimulate alpha motor neuron that will come to this other muscle. What do we call this muscle? Antagonistic what? Muscle. And what will happen to the antagonistic muscle is to activate it. Do you understand? It will inhibit the renal muscle that is involved and activate the what? Antagonistic what? The tricep. For instance, if it inhibits the bicep, the tricep will be what? Activated. Are you there? So this is what we call the deep tendon what? Reflex. Are you there? Alright, so now can I clean this? More light. Now, I said that deep tendon reflex is actually associated with what? The tendon, right? You know, in the tendon we have what we call what do we call it? Golgi tendon organ. Right? In muscle, what do we have? Muscle spindle. And we talk exhaustively about that. And muscle spindle, like I told you, is involved in what? Stretch reflex. Are you there? Whereas the Golgi tendon organ is involved in deep tendon reflex. Stretch reflex usually activates what? Muscles. Are you there? It activates what? The muscles. But deep tendon reflex inhibits the muscle. Do you understand? Why? Because when it contracts the muscle too much, the tendon can actually pull out from the bone. And that's what we call what? Avulsion. It can avulse. Do you understand? So in order to prevent the muscle from over-contracting, right? Then deep tendon reflex usually what? Inhibits the muscle. How does it do that? It sends information via what? Other areas known as association what? Cortex or association areas. Are you there? Association what? Now, one of which is called what? Premotor area. Are you there? Now, premotor area is a part of an area that is known as area 6. This is premotor area. It's just in front of the what? The primary what? Motor what? Cortex. It is in front of what? The primary what? Motor cortex. So we have what? Another area called premotor area. Premotor what? Premotor area. Are you there? Now there's another area which also forms part of area. This is area 6. This is area what? 6. There's another area which forms part of what? Which forms part of area 6, which is called what? What do we call it? This place here. We call it the supplementary what? Motor area. Supplementary motor area. Are you there? It is called the supplementary what? Motor what? Area. Right? Now, the premotor area, the primary motor area is the primary area that is responsible for what? Voluntary what? Movements, action, right? Of muscles and all that. The premotor area is responsible for what? For planning and execution of what? Movement. Are you there? Are you there? The supplementary motor area supplements these areas, right? Are you there? So this area is also known as area 6. It's part of area what? 6. So these areas are the areas that are involved in what? In movement. Voluntary what? Movement. Involuntary what? But particularly voluntary what? Movement. Are you there? Are you there? Even the somatosensory area is also involved. Are you there? Even the somatosensory area is also what? Involved. Are you there? Now, we also have other areas, apart from these areas that are involved in what? In motor activities, right? We also have other areas, like there's an area that is around this region. We call it the Broca's what? Area. Broca's area. This area is primarily involved in speech, right? It's primarily involved in what? Speech. It activates the muscles that are involved in what? Speech, what? Production. Are you there? We call it the Broca's what? Area. In that area, if there is an infarct in that area, right? If there's a lesion, rather, if there's a lesion in that area, what will happen? You will not be able to what? Speak. Are you there? Now, basically, when you see some stroke patients, a lot of them cannot talk. Do you understand why? Because that particular area is affected. We call it the Broca's area. Are you there? There's another area which is called the frontal eye field. Are you there? It is called the frontal what? Frontal eye field area. This area is responsible for coordinating the conjugate movement of the eye. Are you there? It is responsible for coordinating the conjugate movement of the eyes. Are you there? Right, yes. Then there's another area which is called the head rotation area. It is very close to this other area, but it is closer to this area. Head rotation area. Head rotation what? Head rotation area. It works in consonance with the frontal eye field to move the head, to adjust the head. Are you there? In relation to the movement of the eyes. Do you understand?
Yes.
Are you there? Yeah, come in. Then we have another area that this area is involved in fine movement of the what? Of the wrist. Are you there? Area that is involved in the fine movement area that is involved in fine movements of the wrist. Are you there? If that area is destroyed, that particular area, if that area is destroyed, you can move your hand, but you cannot actually carry out dexterous. You cannot carry out certain activities dexterously. Do you understand? With fine precision. For instance, like you can see, I can write, right? I can write. But if okay, let me see. That area helps me to be able to write properly. If that area is destroyed, I can move my hand, but I cannot write. Do you understand? So that area is responsible for fine movement of what? The wrist. So all these areas are basically involved in motor what? Activity. But these are the major areas. The primary motor cortex, located in the precentral gyrus, the premotor area, and the supplementary what? Motor what? Area. All these are areas that are involved in what? Motor activities. Are you there? But then these areas also function in consonance with other regions of the brain. For instance, they work in consonance with the basal ganglia, right? And of course, you know that basal ganglia is a subcortical, is a subcortical group of nuclei that are involved in what? Motor functions. Are you there? They are involved in motor what? Functions. They are involved in starting movements, stopping movement, and modifying what? Movement. So before you execute any motor activities, first of all, information will be sent to what? The basal ganglia. Basal ganglia will process this information and send the blueprints to what? To the cortex. Are you there? So these areas work in consonance with the basal ganglia and also the cerebellum. Do you understand? And also the what? The cerebellum and the brain stem as well. Are you there? Now, coming to descending tracts. Descending tract, like I told you, are tracts that actually originate from the cortex and the brainstem and go down to where? To the spinal cord to execute what? Motor what? Activities or movement. Do you understand? And usually, descending tracts are classified. We have two classifications, two types. I will explain the two. But basically, we have the lateral descending tracts and the medial what? Descending tracts. Are you there? Can I clean this?
Yes, sir.
Okay. All right, so we have what? Lateral, and then we have medial what? Tracts. Lateral, descending tracts, and medial what? Descending tracts. Is it also? Do you have any contrary opinion? Yeah? Do you have any contrary opinion about this? No, tell me one if you do, you can tell me. Let's discuss it. Yeah? Do you have any contrary opinion? Yeah? An extra pyramidal tract. Yeah, I'm telling that for the first time. Yeah. Now, we used to have pyramidal and extra pyramidal tract, but You know, it's an archaic way of saying it. Are you there? It's an archaic way of what? An ancient way of saying it. Everybody knows it as pyramidal and extra pyramidal tract. But you know, knowledge is evolving. Are you there? Knowledge is what? Evolving. So we call it lateral and what? Medial. Now, let's look at how that pyramidal will come about, right? Now, the lateral tract is divided into what? Into corticospinal tract. The corticospinal tract is also known as pyramidal tract. Right? Then we have another one called the rubrospinal what? Tract. Are you there? We have the corticospinal tract and the rubrospinal tract. Are you there? There's another one which is also under this group. What do we call it?
Of course.
Chase. Thank you. We call it corticobulbar. Corticobulbar. If you don't call it corticobulbar, what do you call it? Corticonuclear. Are you there? The other call it corticobulbar tract or corticonuclear tract. It's the same thing as this. Yeah, they do the same thing. So all of them are known as pyramidal what? No. This is not pyramidal. Right? This is not pyramidal. Right? But this one is pyramidal. But this one is analogous to this. Are you there? I will explain it. Now, coming to this one, to medial. For medial, we have the vestibulospinal tract, and then we have the what? The reticulospinal what? Tract, and then we have another one called the what? Tectospinal tract. These are the major what? Tracts. Descending tracts. Are you there? Now, this one is called pyramidal what? Tract. All these ones are called what? Extra pyramidal tracts. Are you there? Now, corticospinal tracts are tracts that are coming from the cortex. Are you there? They are coming from the cortex to what? The spinal what called. Extra pyramidal tracts are tracts that are coming from where? From the brain stem. Are you there? Every other tract that is not coming from the cortex but is coming from the brain stem is classified under what? Extra pyramidal tract. Do you understand it? If you don't understand it, let me see your hand so that I will explain it again. If you don't understand it, tell me. I will explain it. Are they touching this? Are they touching this? Okay, you know that I told you. Okay, not so okay. But they gave me all this information. You see, knowledge is evolving. Are you here? So you can see we have corticospinal tract, rubrospinal tract. Now, also, it is important to know that the vestibulospinal tract is further divided into two. We have the medial vestibulospinal tract, and the lateral what? Vestibulospinal tract. Are you there? Then the reticulospinal tract is also divided into two. Right? We have the pontine reticulospinal tract, and the what? And the medullary reticulospinal what? Tract. Are you there? Also, it is important to know that the pyramidal tract is also divided into two. We have the what? The lateral what? Pyramidal tract, and then we have the what? The ventral, right? Is it not ventral? The ventral or anterior what? Pyramidal tract. can take them one after the other. Right? Now we take them one after the other. Yeah, this is the right thing. Can you see this? Can you see this? Alright, so it originates from where? From the primary motor cortex, the supplementary motor cortex, the what? The premotor what? Area, and even the what? The primary somatosensory what? Cortex. And actually, the primary somatosensory cortex contributes about 40%, right, of the fibers. Then the primary primary motor what cortex contribute what 20%. Are you there? The premotor area and the supplementary motor area contributes how many percent? 30 what percent. Are you there? Yes. Are you there? Now, basically, these fibers will be placed from which layer of the cortex does the fibers will be placed from? You know, we have layer 1, layer 2, layer 3, layer 4, layer 5, and layer 6. So, which area do they originate from? Layer what? Layer what? Layer 3, layer what? Layer what? Is layer 5? Are you there? It's basically originated from where? Layer 5. And that is where we have what? The pyramidal cells. The large what? Pyramidal what? Cells. And what do we call those large cells? We call them what? We call them the bed cells. Are you there? We call them the large what? We call them the bed cells. They are called, the bed cells are known as what? Large pyramidal what? Cell. Are you there? So now, fibers will be from these areas and then fan out, right? Forming what is referred to as what? The coronal radiata. Are you there? It forms what? The coronal what? Radiata. So we call this coronal what? Radiata. Are you there? Now, the fibers will now come and pass through the posterior limb, right? It will pass through the posterior limb of what? Internal capsule. Are you there? They fan out and pass through the posterior limb of the what? The internal capsule. Now, that area is very important. Clinically, it is very significant. Why? Because that area is supplied by what we call the lenticular striatal artery. The lenticular striatal artery is a branch of each artery. It's a branch of the middle cerebral artery. When that artery. For instance, if someone has severe hypertension, right, and that artery is ruptured, what will happen? All the fibers that passes through this area will be affected. Are you there? Alright, so it passes through the posterior limb of the internal capsule, and then, of course, it goes down to where? To the midbrain. This is the midbrain. This is the pons. This is medulla. And these are the what? Spinal cord. Are you there? So it goes where? It goes to the midbrain. Are you there? So what happens in the midbrain? What happens there? Now let me show you what happens. Now in the midbrain, these fibers will pass through the crop cerebral. Right there, and go down to the cerebral what? Pedal. Right, so it passes down the crop cerebral in the midbrain and enters the pons. Are you there? It enters what? The pons. Now, in the pons, if you agree with me, there are some nuclei, group of nuclei, which we call the pontine what? Nuclei. Are you there? We call them the pontine what? Nuclei. That nuclei is very important. It's very, very significant. Why? Because it helps to carry information that is coming from the spinal tract to the cerebellum. Right? So let's draw cerebellum here. Let's draw cerebellum here. So this is what? Cerebellum. Right? Are you there? Then, of course, you know that we'll have something like this. We'll also have something like this now. Right? Now, as the fiber is coming down, right? Especially at the base of the 80% of the fibers will cross with deposit. And we call that deposition pyramidal what? Deposition. Are you there? Okay, let me illustrate this. You know, this place, this is known as what? This is midbrain, right? And then this is this midbrain, this pons. Are you there? Sorry. This midbrain. This is pons, right? This is pons, and this is what? Medulla. Is it also? Now, of course, in the medulla, we have something like this. Are you there? So that the base of the medulla. Around the ponto medullary junction, right? Now, this fiber will pass through the what? The cross cerebellar peduncle to go down the pons, right? And then around the ponto medullary junction, what will happen? There will be what? Deposition. Right? There will be what? Deposition. Right. Are you there? So it will deposit. It will deposit and come here. Forming what? Lateral. What? Lateral cortical spinal what? Tract. That's 80% of the fibers. Are you there? Now, where do they go to? They go to the what? The white follicles. The lateral white what? Follicles. Right? And then end up where? They end up in the anterior what? In the anterior what? Gray horn. Are you there? Now, in the anterior gray horn, what will happen? They usually synapse with what? Alpha neuron and gamma what? Neuron. They synapse with alpha neuron. Then from there, what will happen? The gamma neuron will go down to what? Muscles. Where is your marker? You don't have marker. Are you there? But usually, if you agree with me, the alpha motor neuron will go to what? The extrafiscal what? Muscles. Extrafusal muscles. Then the gamma motor neuron will go to where? To the intrafusal what? Muscles. Are you there? So this is intrafusal what? Muscles. You understand? So the alpha motor neuron will activate the what? The extrafusal muscle and cause muscle contraction. The gamma motor neuron will stimulate what? There's continuous stretching of muscle which brings, we call that coactivation. I think we did it in the last two tracts. Now let's write corticospinal tracts. 20%. That will be what? 20% of the fibers. Now 20%, right? As what? Tract. Yes. So as yes, it is usually 15%. Are you there? 15%. Yes? You don't understand lateral corticospinal tract? How we started? Okay, let me finish now. I will recap. Let me finish. So let's say 15% of the fibers that is remaining.
So where did 5%?
5%. So 5% that is. See, okay, so you see, it is 20%, right? It is 20%. See, this one just give out, they just give us small collateral that innervates the nucleus, right? It is the nucleus that gives out fibers. That's what crosses. Do you understand? And so it is 20%. Don't confuse me. So 20% of the fiber, right? 20% of the fibers will go down as what? As anterior. Are you there? As anterior what? Corticospinal tract. Anterior corticospinal. Know that. The lateral corticospinal tract is responsible for what? That are required for performing what? Special what skills. Like then the anterior tract is responsible for what? What does it do? It innervates what? Proximal what? Muscle. So this one innervates what? Proximal muscles, like muscles of what? Your forehead and all that. Are you there? Alright, so my friend, what were you saying? You don't understand how you started. You just came now. Have you been here? When did you come? Oh, okay. So you should understand now. I said that corticospinal tracts are tracts that they are descending tracts that are coming from where? From the cortex, right? That goes down to the spinal cord. Now, from the cortex, they originate from where? Which layer? Layer 5. And that's the layer where we have what? The large pyramidal cells. Those large pyramidal cells are called the Behr's cells. Are you there? Now, the name of this tract, pyramidal tract, is not because of these cells. Are you there? You know, we call them pyramidal cells. It's not because of these cells. It is because there is deposition around the what? The medullary what? Pyramid. That is why we call it pyramidal what? Tract. Please know that. Now, the fibers coming from the what? They are what? They are 5, right? They come together, they fan out, forming what we call coronal what? Radiata. When they form coronal radiata, they eventually come together and pass through the posterior limb of the internal what? Capsule. This thing you see here is the internal what? Capsule. This one is thalamus. Right? But we are not interested in this. Right? This is not very good. Right? This thalamus. This is what? Internal capsule. This is what? This is what? Lenticular what? Lenticular what? Nucleus. It is called lenticular what? Nucleus. Which comprises of what? Putamen and what? Globus pallidus. Right? But what we are interested in the what? The internal capsule and goes down to where? To the midbrain. Right? In the midbrain, you can see several of 7. In the pons, you know that we have some large nucleus which we call the pontine what nucleus. It gives out fibers to those nucleus, right? Stimulates those nucleus. Now, this nucleus usually gives out fibers across, right, to the opposite side and enter the cerebellum via the middle cerebellar what? Peduncle. Do you understand? And that is how the corticospinal tracts give. Including both the capsule and the lenticular nucleus. Are you there? That artery is of lenticulostriatal artery. Lenticulostriatal artery. It's the branch of what? The middle what? The middle cerebellar what? Artery. Have you done second please? You know second? Okay, let me show you. Should I show you? Yes. All right. Then we have what we call the pontine what? The striatal what artery. It usually supplies this what structure. Now, in that artery, if there is what? If during persons that have severe hypertension, that artery can rupture, right? I also told you that we also have what we call the corticonuclear what? Tract. What? The corticonuclear what? Tract. Now, the corticonuclear tract is analogous to what? To the corticospinal tract. Are you there? If you don't call it corticonuclear tract, what do you call it? You call it corticobulbar tract. Now, the fibers of these tracts are coming from where? From the cortex. Are you there? Can I hear this? Can I hear this? Hey, you don't have time, no? And I'm here wasting time. Am I wasting time? Yeah. All right, so let me not rush. Let me just. This call what? Corona. I'm not wasting my time here. All right. So, for rubrospinal tracts, the tracts actually originate from the midbrain. Are you there? It originates from where?
The midbrain.
From the midbrain. The midbrain. You know, in the midbrain we have what we call the red nucleus. Is it not so? We have the red nucleus in the midbrain. Right? So, usually, the fibers will cross the midline, right, and go down. To cross the midline and go down. Right? And then that's what? The anterior gremlin, right? Are you there? So what does it do? It goes to synapse what? The alpha go to what? Neurons. Are you there? And then go to what? What kind of muscle does it go to? It goes to what? Flexors. Right? It goes to proximal or what? In fact, it goes to flexors of what? Of the arm. Flexors of the arm. Are you there? It goes to flexors of what? Of the upper limb. Flexors of the upper limb. It goes to where? Flexors of the upper limb. Flexors of the upper limb. Now, if the corticospinal tract, especially the lateral spinal tract, right, is damaged, there will still be movement of what? Of your what? Of the upper limb. But you cannot perform what? These what? Activities or fine movements. All those fine movements that you used to carry out will be lost. Why? Because the lateral spinal tract is what affected. Right? But then you can still carry out movement of your arm because of your spinal tract. Are you there? Because the spinal tract is what? Intact. So the spinal tract is responsible for what? Innervating what? Flexors.
Okay.
Of the what? Upper limb. The next one is called what? Vestibulospinal tract. Right? Yes, flexor of the valley. Vestibulospinal tract is not supplied in the lower. I know. The next one is called what? Vestibulospinal tract. Vestibular what? Spinal tract. Now, okay, let me talk about tectospinal tracts first. For tectospinal tracts, tract is coming from where? From the superior colliculus. Are you there? It is coming from where?
Superior colliculus.
The superior what? Colliculus. Or let's say the tectum. And of course, the tectum comprises of what? The superior and the inferior what? Colliculus. Right? Now, these fibers, they come down, they also cross. Are you there? They cross and go down. So in other words, cervical muscles. Are you there? Cervical muscles. So in other words, cervical muscles. So the neck muscles as well. Right? This was the anti-gravity was. Then this other one comprises of what? Pontine and medullary. Are you there? And they actually activate what? Gamma motor what? Neuron. Gamma motor neuron. Right? This one actually activates gamma motor neuron. This one what? Inhibits gamma motor what? Neuron. Right? And which muscle do they supply? They supply what? Extensor muscles. Right? Extensor muscles of the what? Lower limb and flexor of the what? I think this is better. This is what? Better. With this now, you can just. This one comprises of the function. The function is there. The origin is there. Are you there? Then the optic tract, if you go to the optic chiasma and cross, and go to the lateral genital body via the optic tract. Do you understand? From the lateral genital body, right, it will form the optic radiation and go to the calcareous locus. But before then, spiders from the lateral genital body will give out its fibers to come from the lateral genital body and go to the superior colliculus. Is it also via the breakthrough of the superior colliculus? Do you understand? So that's what we now said. Now, from the superior colliculus will now send fibers that will go to your cervical what? Cervical what? Muscles. That will help you to turn your head in relation to that movement and in relation to your size. Do you understand? Am I not correct? If you hear a sound, right? If you hear a sound, that one will come from what? From the ordinary pathway. That is the video what? Colliculus. You see the no, from the olivary what? Olivary nucleus. Are you there? Is it? The inferior colliculus, yes. The inferior colliculus, not the olivary nucleus. The inferior colliculus. From the inferior colliculus. But that one will be coming from where? It will be coming from the cochlear nerve. Are you there? Come from the cochlear nerve that will go up to the inferior colliculus. And but then it can also give a small fiber that will go to the superior or colliculus. The superior will be really good. Am I not correct? All right. You want to ask? I asked. Yes. Feed forward. Yes. I go? I'm tired. Bye bye. When next I come, I'll teach you basal ganglia. Have you stopped it? Please stop it. Next week, we'll do basal ganglia. And then upper big cerebellum. As a